Hello, everyone. Welcome to Health Series Podcast. Today, we're going to be looking at the topic healthcare system of Nigeria versus United Kingdom. When comparing the healthcare system of Nigeria and the United Kingdom, but key differences emerge due to disparities in funding, accessibility, infrastructure, and healthcare outcomes. The first to compare is the area of structure and funding. Nigeria operates a mixed healthcare system with both public and private providers, but public healthcare is severely underfunded. The government allocates approximately 5 to 6% of its total budget to healthcare, far below the WHO's recommended 15%. Many citizens rely on out-of-pocket payments, and there is a strong reliance on the private sector, particularly in urban areas. Nigeria also faces limited insurance coverage with National Health Insurance Scheme, NHIS, primarily covering formal sector employees, leaving a significant portion of the population without any form of coverage. Whereas the United Kingdom healthcare system is primarily public and funded by government through taxation. The National Health Service, NHS, provides free at the point of service healthcare to all UK residents, are funded by around 10% of the country's GDP. The NHS is a single-player system ensuring universal healthcare access without out-of-pocket for most services. There is also a private healthcare sector in the UK, but it's significantly smaller and less relied upon when compared to Nigeria. The second to compare is the area of accessibility and coverage. Accessibility is a major challenge in Nigeria, especially in rural and underserved areas. Healthcare infrastructure is often concentrated in cities, leaving rural population underserved. Additionally, healthcare services facilities may lack essential medical equipment, medications, and trained staff, further reducing accessibility and quality of care. Less than 5% of Nigerians have health insurance, leading to high out-of-pocket expenses, limiting access to adequate healthcare for low-income populations. Whereas the United Kingdom offers comprehensive coverage to its residents through NHS, with services accessible across urban and rural areas. Although rural areas might experience some delays in accessing specialized services, the system is designed to provide access to healthcare services across the country. NHS coverage includes a wide range of services from general practitioner visit to specialist care and emergency services without additional cost at the point of care. The third to compare is the area of workforce and infrastructure. Nigeria faces significant shortage in healthcare workers with an estimated doctor to patient ratio of 4 doctors to about 10,000 people. This shortage is exacerbated by high rate of immigration among Nigerian healthcare workers due to poor working conditions, inadequate salaries, and limited career development, advancement opportunities. Infrastructure is also, particularly in public healthcare facilities, often inadequate, with some facilities lacking basic supplies, electricity, or clean water. Whereas the United Kingdom has a higher ratio of healthcare workforce with around 28 doctors per 10,000 people. However, the NHS faces challenges related to workforce shortages in some areas. There could be long wait times, employee burnout. Despite these challenges, the infrastructure in the UK is generally advanced with well-equipped hospitals and facilities. The fourth to compare is the area of health outcomes. Nigeria has relatively poor health outcomes with high maternal and child mortality rates, a low life expectancy of about 55 years on average, and high incidence rate of communicable diseases such as malaria and tuberculosis. Non-communicable diseases are also on the rise, but limited resources and inadequate preventive care contribute to low management rates for these conditions. Whereas the UK has relatively better health outcomes with life expectancy of about 81 years. The NHS emphasizes preventive care, resulting in better management of non-communicable diseases like heart disease, diabetes, and cancer. Maternal and child mortality rates are low. Infectious diseases are effectively controlled through public health initiatives and vaccination programs. Having compared both systems, let's now look at some of the key challenges, starting with Nigeria. Major challenges include underfunding, insufficient healthcare personnel, infrastructure deficits, and limited access to health insurance. Additionally, brain drain, also known as JAPA, and inconsistent policy implementation in the development of the healthcare sector. Whereas the United Kingdom, key challenges in the UK include long wait times for certain services, increasing demand due to an aging population, and pressures on the NHS budget. Recent issues related to workforce shortages and underfunding have also sparked debates in NHS sustainability. In conclusion, Nigeria's healthcare system struggles with limited resources, uneven access, and significant healthcare workforce shortages, creating challenges in service delivery. The UK NHS provides universal healthcare with well-established infrastructure, though it faces challenges related to demand, workforce shortages, and funding sustainability. Would appreciate if you like the video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. Thanks for listening.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.